Hello, my name is Michael Radiker. I'm currently a full-time registered nurse and a part-time student at Lock Haven University. I'm pursuing my bachelor's science degree in nursing, and I'm taking care of the critically ill this semester, and we need to do a YouTube project. I chose to do defibrillation with the Zoll monitor. So first of all, the Zoll monitor M series, it's defibrillator monitor pacer, different modes. This is a biphasic machine for the defibrillation monitor. It's a 3-lead system, left lower, right arm, left arm, and here is the defibrillator pads, and it shows a diagram of where to put them. So basically, we arrived to patient that we're going to shock. This patient, I chose to do a patient in ventricular fibrillation. So it's cardiac arrest situation, CPR is in progress, compressions, ventilations, all that stuff. We get there, need to put the monitor on first of all. So just like an EKG, there's 3 leads, left lower, right lower, left leg, and they're attached with normal electrodes that you would put on for an EKG monitoring. So I can't hook them up to the mannequin because I can't defibrillate the mannequin. I'm going to hook them up to my simulator here. So white right, smoke over fire is a way that I remember where they go. So I'm going to hook them up to my simulator here. And whenever we turn the monitor on to monitoring mode, change it to lead. And that will take it to lead 1, and it shows some electrical activity. It's a defib. And we know from previous studies in this class that the only definitive treatment for ventricular fibrillation is defibrillation. So we need to put these pads on. There's a diagram of where to put the pads on. This one goes on the front, medial to the nipple line right below, and this one goes on the back. There is CPR in progress, as I said, so you need to work as a team to get this on. You need to roll this patient and put it on their left back. These pads sort of encompass the heart, so I said before this is a biphasic system, which means there's electricity going from each pad. The difference between a biphasic and a monophasic is that a biphasic will take less energy to do the same thing. And this, of course, is a biphasic, and I don't have a monophasic machine to show you. Alright, so we have this on. We need to immediately defibrillate this patient. ACLS guidelines call for energy levels of 120 to 200 joules. It's been my experience that whenever you're in these situations, you deliver the highest shock available, but you can do 120 to 200, and ACLS recommends, if you don't know what the energy level of your machine is, just max it out. Just go all the way to the top. So we're going to change the machine to defibrillate, and we're going to raise the energy level to 200 joules, and I'm going to make the announcement charging. CPR is still in progress, and it's going to continue until we're ready to defibrillate. Once we are charged, I'm going to make the announcement. I'm clear, you're clear, everybody who's doing CPR is going to back up. All clear, everybody touching this bed, anything in direct contact with this bed must get back because energy is going to be delivered through it. So we are going to defibrillate, push the shock button at 200 joules. The patient's going to bounce or jump because of the electrical energy going through them. People are immediately going to get back on this patient and continue with CPR. And that's going to continue for 2 minutes, and we're going to recheck again. After 2 minutes, if the patient remains in ventricular fibrillation, we're going to defibrillate them again. And if they would convert to a sinus rhythm, we would just do supportive services. Or if they would go asystole, not indicated for a shock. So this is pretty much what I went over is ACLS guidelines, hospital policies as well to govern what you're doing. There should be a physician here with you as well. And anything further can be directed to me. Classmates, you have my email address. Otherwise, good luck.